Thanks, Michelle. Available for folks who aren't able to join, and also make it available on our website. That being said, we want everyone to feel super comfortable in this space. So, while we love seeing faces for participation, if you feel more comfortable with your video off, we totally understand and encourage that. We also plan to end the recording right before the question and answer section so that everyone can kind of ask whatever questions are coming up. And we welcome you to add those into the chat if you'd like any questions, but we are going to hold them until the very end, and then allow for people to either ask the question in the chat or come off mute, whatever you're most comfortable with. And yeah, we're at about 36 folks, so that's great. Welcome, everyone. Let's see, should we go ahead and get started, Michelle?
I think so.
Okay, yeah, if you don't mind pulling up our slides, and we can just kind of begin with some introductions.
Just one
Yeah.
moment.
And I'll go ahead and kick us off with the introductions while Michelle pulls the slides up. So my name's Katie Knutson. I use she, her pronouns. I work for Clackamas County Public Health as a program planner for our substance use and overdose prevention program. And then I'm also a part of our Naloxone work group, which is kind of a smaller subset group of our Clackamas Community Alliance. And we really work across systems to try to increase access and improve the lives of people affected by substance use. So if that's something that you're at all interested in joining, feel free to reach out to us. We can kind of connect you into that group, however you'd like to be involved. I'll go ahead and pass it over to Michelle, and then we can pass it to Liz for introductions.
Hi, I'm Michelle Krutniak. I use she, her pronouns, and I am the Strategic Prevention Framework Program Supervisor with Northwest Family Services.
Hello, my name is Elizabeth Smith, she, her pronouns. Most people refer to me as Liz. I am training and education coordinator for Oxford House. I am also a person in long-term recovery. I have been in recovery from opioid addiction since March 8th, 2010. Naloxone is something that saved my life 8 times in the last year that I was using. So it is a huge give back for me to be able to be here today and to be able to share this with you all. I want you to remember that, though, because I said I got into recovery in 2010. What that means is that it wasn't really fentanyl around during that time. So if that puts the reality of it into perspective for you all, please remember that while you're listening to this. And remember that there's a good chance that that person that you're learning how to save their life might be somebody just like me. So thank you for attending today.
Thank you, Liz. I always appreciate hearing your story, and just I'm very grateful to be able to work with you in this area. It's super important. So, Michelle, I'm not seeing this. Oh, there we go. We have the slides. So yeah, so I would love to go through and hear everyone else in the room and your introduction, where you're from. Thankfully, we have a huge group today, so we don't have time for that, but I've seen some people dropping their names in the chat. So feel free to do that. We'd love that. I'm going to kind of ground us in why we're here today. So, I think we're on the first slide. So once we're able to, we'll go to kind of the objectives for today's training. And
Is it sharing full screen or no?
no.
Okay, let me fix that. I have like 4 monitors. And
Yeah.
I
And
agree that.
no worries. While Michelle's working on that, I also just want to hold space for, just the fact that this is a really heavy topic. I'm going to talk about some data, and I just want to kind of ground us in the fact that these are people. These are when I talk about overdoses, these people were family members, their neighbors, their friends. These lives matter, and really do take care of yourself during this training, whatever that means for you, and feel free to reach out to any of us afterwards if you need support for yourself or for a loved one. And so let's see.
Just
And Michelle,
one second.
if you want me to try, I'm also happy to try sharing as well.
I just unplugged all my other monitors, so it should work now.
Okay, cool. Yeah, it's always challenging when you're navigating multiple screens. There we go. Perfect. Thank you.
Mhm.
Yeah, so we're here today, as many of you know already, because there has been a large increase in overdoses in our community. And this is true not just in Clackamas County, but really across the nation. And these increases are largely due to a drug called fentanyl, which we'll talk more about in a moment. But really what we want to convey today is that like you can help save lives. We're going to talk about a medication called Naloxone that is very safe and effective and very easy to use. So we're going to be providing training on how to identify and respond to overdose. And as I mentioned, we're just asking folks to save questions for the end. But if you want to drop it in the chat so that you don't forget, feel free to do that. We'll come back to those at the end. All right, next slide, please. So I just want to start with kind of some grounding information. So what are opioids? Opioids are a type of drug that are sometimes used to treat pain. So there are prescription opioids like OxyContin, like Vicodin and morphine. And opioids also can be very addictive as well. And so the increase in prescription opioid use really led to this rise in illicit opioid use, which is predominantly what we're seeing today in terms of these overdoses. And examples of illicit opioids include heroin and fentanyl. How the opioids work is they bind to opioid receptors in your brain, and they produce different types of effects like pain relief. They can increase relaxation, but they also create euphoria for people who use them outside of kind of their intended use. Too much opioids can lead to slow or stopped breathing and cause an overdose, and that's kind of here today what we're going to talk about. Next slide, please. So fentanyl specifically, you've probably heard of it in headlines, or you might be very familiar with it, but it is a synthetic opioid, which means that it was manufactured in a lab rather than being a naturally occurring opioid like what is in heroin and morphine. And fentanyl can be found in different forms, but is most commonly found in the fake blue pills that are called like the blues or M30s, and then also in powder form. It has no odor, it has no taste, but it can come in any color, but is most often white. And then fentanyl is extremely potent, which is why it is super dangerous and why it's leading to this increase in overdoses where it is 50 times stronger than heroin and about 100 times stronger than morphine. So it's just really kind of changed the game in terms of substance use and just, yeah, very much more lethal. All right, next slide, please. So I want to talk a little bit about kind of the bigger picture. And while this slide is, you know, a couple of years old at this point with the data, I do think it does a really good job of just kind of showing the change in overdose trends across the last 25 years or so in the United States. So in this graph, the red line indicates or represents all fatalities from all types of drugs. And in the months ending in April of 2021, it was the first time that we surpassed 100,000 fatalities from overdoses in the United States. In that year, about 75% of those overdose fatalities were due to some type of opioid, whether it's prescription or illicit. And then more specifically, those that were related to synthetic opioids, such as fentanyl, made up around 64% of those fatalities. And to kind of put that in perspective, this, 64,000 fatalities that were related to fentanyl was more than the total number of overdose fatalities from all drugs in just 2016. Unfortunately, in 2021 and in 2022, we did continue to see increases in these fatalities. In 2021, it was 106,000, and in 2022, it was over 111,000 in the United States from all types of drugs. And thankfully, we are starting to see these numbers start to level off and actually begin to improve in certain parts of our country. So going to the next slide and zooming in a little bit more on where Oregon kind of fits into the picture. This shows the percent change in overdose fatalities across the United States. And so what you can see here is that there are a number of states that are blue, and that means that they saw a decrease in overdose fatalities. That's really great. That's really positive. That doesn't mean that they had fewer total number of overdose fatalities than the orange states. It just means that they're starting to see some improvement. As you can see, Oregon was not one of those states. Unfortunately, we are still seeing increases, and it was close to 22% increase from May of 2023 to May of 2024 for overdose fatalities in Oregon. And there are a lot of kind of theories. I think what most experts agree on is that drug trends tend to sweep the East Coast to the West Coast, and we saw that with fentanyl. Fentanyl really arrived on the East Coast several years before it hit Oregon. And so we're a little bit more delayed on how those impacts have affected Oregon. And we're hopeful that in the coming years, we're starting to see kind of numbers locally start to level off and hopefully even decrease, so that hopefully in the coming years, we will also be one of these blue states. So you can see overall, there was almost a 13% decrease in overdose fatalities across the United States. Some Oregon statistics. So we ranked second highest in the country for substance use disorder. We were the first highest for prescription opioid misuse, and also the first highest for methamphetamine use. And so it's really important to acknowledge that too. With the overdose fatalities that we see in the community, a lot of them involve multiple drugs, not just fentanyl or opioids. And we do see a lot of methamphetamine showing up in those toxicology reports as well. So this is really larger than just opioids. It's a larger substance use issue. And we can go to the next slide. This table shows kind of how fentanyl has impacted different age demographics across the state of Oregon. And again, these numbers are a little bit outdated, but what we are seeing in more recent years is really kind of on track with these trends. We continue to see an increase in overdoses related to fentanyl across every single age group. And we're seeing definitely a higher number of overdoses in youth than we would want to see. We don't want to see any fentanyl overdoses in youth, but thankfully those numbers have remained relatively small compared to the other age groups that are here. The kind of middle age and older, more middle age adults are the groups that have been experiencing overdose and fatalities at higher rates from fentanyl. Okay, the next slide. This slide I think is really important for helping us understand the circumstances of the folks who have died from an overdose. So the Oregon Health Authority published a legislative report from like a fatality review that they did to better understand what the causes are and what the circumstances are for people who have died from an overdose. And some of the themes that came out of that report include that around 78% of people who died were not receiving any treatment for mental health issues or substance use at the time that they overdosed. We also know that 71% of people who unintentionally overdosed were not administered naloxone. And that's what we're hoping, that we can help change today. We know that some of the root causes of substance use and overdose are a lack of community. We know that people are very isolated. Mental health issues are a huge factor. And then, of course, absence of basic needs like housing and food, shelter. We also know that there is a significant portion of people who had been diagnosed with a mental health illness, and around 20% of people were houseless at the time of their overdose. So that is definitely a significant amount of people, but I think, at least for me, when I saw that, it was less than I had expected. And so we can't assume that this is something that impacts, only people experiencing houselessness, that 80% of people are housed at the time of overdose. So it impacts everybody. And we also know there's a great deal of stigma around substance use still that really prevents people from reaching out and accessing services. But there's a lack of access to services like shelters, detox facilities, and treatment centers. And so even for somebody who does want help, there's not always resources available to them right then and there. And so that's something that we are also really working to improve across multiple systems, and also making sure that people know what resources exist within their community as well. Okay, next slide. Now I'm going to shift gears a little bit and just talk very briefly about a new drug that has made headlines. Unfortunately, a lot of not great headlines. It's a drug called xylazine. It is an animal tranquilizer, and it is often mixed with fentanyl to prolong the effects of fentanyl, because fentanyl has a very short half-life. So that requires people to use fentanyl much more frequently in order to not experience withdrawal. And while xylazine is very prevalent in certain parts of the United States, particularly like the East Coast, it is really only just beginning to show up here in Oregon, and we've only seen really small numbers of it. So a lot of the messaging and media around this has been very fear-based, very stigmatizing. And those things can really prevent people from accessing care when they need it. So we're here to really, encourage people to, just try to show compassion for people who use drugs and help connect them to the care they need. But the reason why we mention this is because if xylazine is present in the drugs, it might impact the way that the person responds to naloxone when it's administered. And so Elizabeth is going to talk a little bit more about what that means. It doesn't necessarily change what we recommend for the response, but just kind of knowing that it might look a little bit different. And so that's kind of what I wanted to share about that. And I will go ahead and pass it to Michelle for the next section.
Alrighty, for this next section, we are going to talk about what naloxone is, myths and facts surrounding naloxone, fentanyl, and xylazine, laws and regulations that might be important for you to know, and then we'll pass over to Liz to go over risk factors, signs of an overdose, and how to respond. Naloxone is a life-saving medication that can reverse overdoses caused by opioids and opioids only. We will go into greater depth about how about naloxone and what to do with it later on in the presentation, but it's just really important to know that naloxone can reverse overdoses and people experiencing opioid-related overdoses.
Michelle, I just noticed some folks are having a hard time hearing you. I'm wondering if you might need to adjust your earbuds.
Yeah, let's see. I can't see the chat, so that's helpful. Is that any better? No. Okay, we'll just ditch the headphones then.
Okay, thank you.
Audio readjust on all fronts.
How is it now? Okay,
How
sometimes
much
they
better?
don't work for me, so it just depends on the day. So we'll move forward. I'm just going to repeat the slide because I want to make sure this is really important information not everybody can hear. Naloxone, also known as Narcan, which is the brand name of the medication, is a life-saving medication that can reverse an overdose caused by opioids and only opioids. For the next part of this presentation, we're going to play a game. It's called Myth or Fact, and feel free to either shout out the answer, put it in the chat. Yeah, either shout out the answer or put it in the chat. Again, I can't see the chat, so Katie will give me an overview of what we're thinking. Myth or fact, naloxone encourages drug use and discourages people who use drugs from seeking treatment.
Myth.
I'm seeing a lot of myth in the chat also.
Alrighty, you are right. This is a myth. Death keeps people from seeking treatment. To be frank, opioid overdoses using naloxone gives someone a second chance at life where they can maybe go and seek treatment or not, yeah, so they can continue on and possibly get treatment for their condition. Naloxone is another drug that can be abused. Myth or fact?
Seeing a lot of myth in the chat again.
You are right again. Naloxone is safe and effective, and it has no potential for abuse. Naloxone, if you don't have opioids in your system, it will not do anything. So it's safe in most circumstances. Myth or fact? Overdoses are more likely to happen in long-term users. Myth or fact?
Seeing a little bit of both for this one. Some people say myth, some say fact.
This one is a fact. Overdoses more often happen in long-term users with 5 to 10 years of experience. This actually has a lot of factors that play into it. People who use opioids or fentanyl or whatever type of opioid more often, they have to higher their dose to receive the same effects. This is called tolerance. So they may increase their dose to a point that causes overdose. It could also look like somebody is just using more often than another person, so it increases their chances of experiencing an overdose. And there's other factors that go into play that we will talk about today. Naloxone can be given by the person overdosing. In other words, self-administered. Myth or fact? Can naloxone be self-administered?
I'm seeing both myth, fact, kind of a equal amounts of each.
This one is a myth. During a drug overdose, an opioid user will be unable to administer Narcan for themselves, and this is because they're unconscious and not breathing when they're experiencing an opioid-related overdose. So somebody would need to give them the medication. Myth or fact? Naloxone is not safe for children, pregnant people, or pets.
Seeing a combination of both again, myth and fact.
This is a myth. Naloxone will only work if someone has opioids in their system, so it is safe for anyone to use. So, for example, if somebody who didn't have anything in their system or was something other than an opioid used Narcan, it wouldn't have any effect on them. And that's why it's safe to use for most everyone. Myth or fact? Naloxone will not work if a person overdosed on something other than an opioid.
Seeing a lot of fact.
That is true. I gave that one away at the beginning. Naloxone will only reverse the effects of an overdose caused by opioids. Excuse me. Naloxone does not prevent deaths caused by other substances such as alcohol, cocaine, or methamphetamine, or any other sort of substance. So it had to be opioid based because of the way the medication works in the brain to counteract the overdose. Myth or fact? If you are using with someone and they start overdosing, you will not get arrested if you call for help. Myth or fact?
Seeing everyone say fact so far.
This is a fact. The Good Samaritan overdose law protects you from being arrested for any drug-related charges. And I'm putting an emphasis on drug-related charges because if 911 or first responders show up and there's something else going on that is illegal and it's not related to substance use, they can still get you on that. Like, for example, child abuse, it could be driving while intoxicated, which is kind of on the line there, but any sort of like drug possession or use charges, you cannot be held liable for. Myth or fact, naloxone is difficult to access.
I'm seeing myth.
This is now a myth. It used to be a fact. It used to be a lot harder to get your hands on, but naloxone is now over the counter and can be purchased from any pharmacy in Oregon. Most insurers will cover the cost of naloxone, including OHP. You do have to say, if you're going through your insurance, you have to say that the Narcan is for you. You can't say you want it because you work with a population who needs it. If you want your insurance to pay for it, you have to let them know it's for you. If not, it's pretty cheap. I mean, relatively cheap. It's about $40, give or take, and you can find coupons on GoodRx. There's other ways to access for free, including local syringe exchanges. Yeah, so emergency services and fire agencies, if you ask them for naloxone, they can give it to you now as well. And Project Red, which we'll be talking a little bit more at the end. Myth or fact? You cannot overdose on fentanyl by touching it. Myth or fact?
Seeing a combination of myth and fact for this.
So this one, that's a typical answer we typically get is a mix between myth and fact, because there's a lot we hear in the media and amongst people talking about fentanyl because it's such a sensational topic. Concentrations required. So it is a fact. You cannot overdose on fentanyl by touching it because the concentrations required for an overdose are not achieved through routine skin contact. So just touching it with your skin, if there's no open wounds, would not cause an overdose. It would need to come in contact with like your mouth or any open, like a large open wound, etc. But just by touching, the amount of fentanyl that you'd have to touch to have an overdose would be a lot. And it's actually, there's no like founded reports. We've heard reports in the media, but it's closely related to, it's really scary when you're responding to an overdose. Somebody might come in contact with fentanyl and it known to cause panic attacks because it's a fatal substance, and that's what's more consistent with what we've seen in the media is related to people either experiencing panic attacks or something like that rather than an actual overdose. Myth or fact? Basic PPE, and that's our protective equipment, is enough to keep responders safe. So basic PPE is enough to keep responders safe.
And PPE is personal protective equipment.
Thank you, Katie.
Yeah.
I was blanking on that.
I'm seeing a lot of fact in the chat.
That is a fact. Basic PPE is fully adequate. This includes nitrile gloves, simple surgical masks, or an N95 if you desire. CPR, face shields are good to have, and just always wash your hands afterwards. Myth or fact? Feeling sick is a symptom of an opioid overdose.
Seeing myth in the chat.
Alrighty, this is a myth. Symptoms are not feeling sick is not consistent with an opioid overdose. Rather, like we mentioned earlier, it can relate to anxiety or panic attacks people feel when responding to an overdose or coming in contact with the substance. Myth or fact, fentanyl and xylazine require more doses of Narcan to reverse an overdose when combined.
I'm seeing fact in the chat so far.
This is actually a myth, and it's because xylazine is not an opioid and it doesn't respond to Narcan. Though, fentanyl is much stronger than other opioids, Narcan is actually highly effective in reversing fentanyl-related overdoses. So even though it's really strong, Narcan generally does a really good job of responding to fentanyl. And just to go back to the first part of that, xylazine isn't an opioid, so Liz will talk about what the interaction might look like and how it's a little bit different, but it doesn't necessarily impact the amount of Narcan one needs. Myth or fact? Oh, myths about fentanyl and xylazine are harmful. Myth or fact?
I'm seeing fact.
That is true. They perpetuate misinformation and cause people to delay or refuse to render care, and it further stigmatizes people who use drugs. So for instance, if somebody believes a myth about fentanyl, like touching it can lead to an overdose, it might delay somebody in responding to the overdose by giving them naloxone. Thank you for playing that game with me. And then we are going to move on to the next portion, which is talking about laws and regulations that might be good for you to know. The opioid overdose prevention package passed during the 2023 the opioid overdose prevention policy package passed in 2023, and it includes protection for businesses, public building owners, and schools when administering Narcan. It decriminalized fentanyl test strips and allows first responders to leave behind naloxone. And the last part is it allows minors under 15 to receive substance use disorder treatment without permission from guardians or parents in certain situations. This is very similar to how our mental health system works. If the youth would be put in harm's way by bringing the parent into the equation, then the parent doesn't need to be consulted, but in most cases they would be. Naloxone in youth. I know a lot of our community partners work with youth, so I'd like to share this with you all. It's important to know the laws when providing naloxone to youth because there's a couple caveats. Naloxone is safe and effective for children, so you can't hurt children by giving them Narcan. Naloxone is given to the same way to youth as it is to adults. However, the age of consent is 15, and you must get parent or guardian permission before giving out Narcan to those under 15. And the big but here is you can administer Narcan to anyone experiencing an overdose. It doesn't matter their age. So you can administer Narcan to youth. By giving out, we mean you can't hand over Narcan to a youth to have that's under 15 to have for later or to have on hand. That's where it differs.
Unless you have parental consent to do so.
Yes, thank you. Protections for those who administer naloxone. Under Oregon law, a person who administers naloxone while acting in good faith is immune from any sort of liability. So if you suspect someone is having an overdose, do not hesitate to provide naloxone. Alrighty, I'm going to pass it off to Liz. Thank you.
Thank you, Michelle. Like I said earlier, I am Liz. Hello, thank you so much for being here. I really want to pass on my gratitude for you, the community members, being willing to participate in this and educate yourself. This is something that is so near and dear to my heart, and I really love it when absolutely anybody is willing to learn about this. So let's talk about risk factors for overdoses. First and foremost, mixing drugs. So putting anything else intentionally in together, mixing benzodiazepines with opioids, mixing alcohol with opioids, things like that. But what is really scary is what's happening right now is that people are unintentionally mixing drugs because people are not aware of what is in their supply. So that is a huge risk for overdoses. Another risk factor is reduced tolerance. Now, this can be somebody who hasn't used before, is quite the novice to using these. It could be somebody who has spent time in treatment, recovery, jail, anything like that. A reduced tolerance by using the same amount or an unexpected amount almost always results in overdoses. Another is new supply or changes in the quality. Something that I would like to point out in regards to this is that I've received several notices that in the last week, some really strong opioids, fentanyl in general, have hit Seattle, Washington. And what we know about the supply chain is that usually a lot of it hits Portland next. So please be very cautious in letting people know. What arrived in Seattle resulted in several overdose deaths in the last week. So anything that is new to the supply or changes in the quality, which it is such an inconsistent amount of fentanyl that is in things anymore, that there is not a really easy way to monitor that. Another one is not being able to decide your dosage. Now, this might be because of a change in quality from going to a new supplier, or it could be because somebody else has given it to you, like they have set up the amount for you. The number one reason that people die of opioid overdoses is because they used alone. People who use by themselves, like you heard Michelle say earlier, cannot administer naloxone to themselves. And you heard the data of how many people were by themselves when they overdosed and passed away. So one of those resources that we had was the Never Use Alone hotline. I really do encourage that because the only way that we're getting people to find recovery is by keeping them alive. Next slide. How do you recognize an opioid overdose? So what is it going to look like? First of all, you need to know that it might not happen right away. It could happen a distance away from the actual use. So please make sure that people are being educated to know that just because they got through the first 5-10 minutes after using doesn't mean that they're not going to slip into an overdose. Signs that you might be able to see are ashen color to the lips, skin, or the fingernails, like a bluish or gray tone, that you cannot wake them up. Not breathing or infrequent breaths, this shallow breathing, or this really disturbing gurgling sound, which is the body struggling to pull oxygen in or out. But the most obvious sign of an overdose is the person's down, they're not responding to you. Another one that might be that there are drugs present, that you can see drugs around the person. That's usually a pretty good indicator that they have overdosed. Next slide. So what does it look like if somebody is heavily intoxicated versus an overdose? So if they are heavily intoxicated, they might be nodding out, but still responding to you, being really sleepy, presenting as intoxicated, but they are still breathing. If they're trying to speak to you, it might be slurred speech. Now, on the flip side, they are not responding to you if it's an overdose. They're not breathing, or they are breathing very slowly. It's slowing down and stopping, or they are making that deep guttural sound, which sounds kind of like snoring. They have cold or clammy skin. Again, that ashen color to the skin, or blue or gray tone to the lips or the fingernails. That's a lack of oxygen getting out to the extremities. And they're not speaking to you, right? They're not responding. So If somebody happens to be heavily intoxicated, please stay with them. Keep communicating with them, monitor them, and make sure that you keep them talking to you. If you can get them up and moving around, wonderful. If they are presenting as having an overdose or they have stopped responding to you while you're monitoring them, please call 911 immediately and do administer naloxone to them. Next slide. First of all, when you come upon somebody and it might possibly be an overdose, make sure that you are safe. Make sure that it is a safe situation for you to get involved in. The majority of the time when people are overdosing on the street, their friends or people that are around them are calling out and requesting naloxone or do you have Narcan on you? But not always. Sometimes you will come across somebody who's just down. Make sure that it looks like a safe situation. If it doesn't, please at minimum call 911 and get somewhere safe and wait. Please do not give aid to them unless it's safe for you to do so. Next slide. So how do you respond to the overdose? Let's say somebody is unconscious, they're down, you believe that they might have overdosed. First of all, you want to try and wake them up. So the best way to do this, if it's somebody that you know, you can go on ahead and yell their name. You could also threaten to Narcan them. Let's say you came across somebody who was on the sidewalk, somewhere out on the street. A really good thing to do is to kick their foot and threaten to Narcan them. If they can hear you, they're going to respond, okay? If you are comfortable doing so, please check to see if they're breathing. A good way to do this is to put your cheek over their nose and mouth if they're down on the ground, because you can feel if oxygen's coming out. Another really cool trick is to grab your cell phone and stick it underneath their nose. If they're breathing, it's going to fog up and you're going to know that. And you don't have to like put your face right there on their face. If you're not able to wake them up, they're not responding, and nothing else seems to be successful, a really good thing to do is what's called a sternum rub. You take your knuckles, I don't know if you can see my picture, but you take your knuckles like this, and you're going to rack them up and down on their sternum. It elicits a pain response, but it's not actually harming the person, and sometimes it can shock them out of it. Failing that, please. Second thing you're going to do is call 911. Call them immediately. The best thing that you can say is that you have an unresponsive individual. Unfortunately, a lot of the time they do have to prioritize the calls, and you don't want them to deprioritize it because you don't necessarily know what all is going on. So just say you have an unresponsive individual, put it down on speakerphone so that it is still nearby. The next thing that you want to do is you want to administer the naloxone to them. So let's say that you have nasal Narcan on you. First thing you want to do is make sure that the individual is laying flat on their back with their head tilted back. Narcan is a liquid, so if they're on their side or sitting up, it's just going to roll out and it's not going to get as much to them. So you want to plug it straight up either nostril. Keep your 2 fingers on the top of it and push the plunger with your thumb. You have to push it kind of hard and it will crack a little bit as it comes loose, and then it will spray out. Please keep their head tilted back so that it can roll back and be absorbed in the mucous membranes. Next slide. The next thing, if you are comfortable doing this, is I would really like you to provide rescue breaths. So when somebody has ingested opioids, they are experiencing a respiratory system response, okay? The lack of oxygen getting to their brain is being caused by the opioids, right? So in order to keep them alive, please, if you're comfortable, provide rescue breaths for them. I believe it was Michelle who talked about CPR shields. They are really amazing, and they are only like 60 cents each on Amazon. And there are a lot of community partners handing them out with Narcan. So if you have one of those, please use it to help keep yourself protected a little bit. So before you give them rescue breaths, you want to make sure that their mouth, that their airway is clear. The best way to do this is if you're comfortable in doing this, you're going to tip their head to the side, take 2 fingers and scoop their mouth. If you're not comfortable doing that, tilt their head back and at least look in their mouth so you can see if there's anything in there that might be forced down their throat. Once you've made sure their airway is clear, remember they're sitting on their back, laying back on their back, head tilted back. You're going to pinch their nose, open their mouth, and give them a short breath. So it's 1 breath every 5 seconds. What you want to do is about a 4 count in and a 1 count out. This is going to continue for at least 30 seconds, so giving them 5 or 6 breaths. If you haven't done rescue breaths before, it's really kind of scary and hard to keep track of. So once you give them a breath, maybe sit back and take 2 breaths yourself to make sure you're not hyperventilating. While you're doing these rescue breaths, you should see their chest rise and fall. If you see their stomach rise and fall instead, try repositioning their head and stretching their neck a little bit to try and get it into their lungs. After about 2 minutes, now we say 2 minutes. I know that's a really long time, but if you've been on the phone with the 911, your phone's going to be counting it off for you, so you can tell how long it has been. So if it's been 2 minutes and they're not responding still, go on ahead and give them a second dose. Now, what I do want to tell you is that if you have given them some of the other types of nasal naloxone out there, there's one called Cloxido. This is an 8 milligram dose. If you've given them one of the really stronger ones, please wait a full 3 minutes. It's not always good to give more. It's just going to take more time for it to work on things like fentanyl. So if you remember what side of the nose you gave it into, please put it in the other side. If not, go on ahead and do whatever. Continue breathing for them and giving it 2 to 3 minutes before you give them another dose. If they start breathing on their own, you have reversed the opioid part of the overdose. So what that means is there might be something else on board, like xylazine that we talked about. If there's xylazine on board, the person will start breathing on their own, but they're going to be sedated and not responding still. So once they start breathing, I want you to put them in what's called the recovery position. That's on their side, hands under their head, with their top leg forward to keep them from rolling over and possibly asphyxiating or stopping breathing. Next slide. Yeah. This is really important. I love this. 2 is safe, more is waste. After administering the naloxone, please wait at least 2 full minutes before giving them another dosage, okay? A lot of the time, it's going to take 1 to 2 doses, right? These stories of 5 to 7 doses, it's sensationalized. That's somebody who panicked and gave them more quickly most of the time, okay? It does take a while to work. Please make sure that you are still breathing for the person and helping them while it's trying to act in their body. If there are no changes, absolutely give them another dose, but it's not going to help to continue giving more doses within that 2 to 3 minute time frame. You're just wasting medication and possibly making them very, very sick. Now, to clarify, by very, very sick, I mean like people who are dope sick from not having the opioids in their system anymore. So here is a picture. That's where it is. Here's a picture of the recovery position. That's what it looks like. Putting the hand under the head and that upper leg forward so that their arm and leg keep them from rolling over. Please make sure that if they are conscious and they start responding to you, that you, or if it looks like they're starting to stir, go on ahead and take a step back. Make sure that you're giving yourself a little bit of safe space to protect yourself and start talking to them. Assure them that they do need some assistance. Tell them what has happened. A lot of the time, they're not going to want to go with the emergency responders, but please make sure that somebody stays with them if possible to keep them from slipping back into the overdose. Next slide. What I was talking about right there. So when they start to wake up from an overdose, make sure that you communicate with them, let them know that you gave them naloxone. Most of the time, they're going to be very sleepy and confused. I kind of liken it to a little kid when they fall asleep in the car and then they wake up somewhere else entirely different. It's really confusing, okay? Another side effect of naloxone is that it has covered the opioid receptors. So all of the opioids that are in their system have been scooted off of those receptors, making them immediately sick if they're somebody who has been consistently using opioids. So there's a good chance that they're going to be nauseous, vomiting, shaking, cold, sweating, all of the signs of being dope sick. And please communicate with them that it is going to wear off. Next slide. This is one thing that I think is so very important. Naloxone has a half-life, so that means how long it's going to last in your body of 30 to 90 minutes. There is a really good chance that they are going to want to, first of all, immediately use again. And I can speak from personal experience that your brain does not understand the concept that you're going to be okay in a few minutes when the naloxone wears off. Please do your best to advise them not to use in the next hour and a half, because the naloxone is still going to be in their body and it's not going to help them at all. It's really important that somebody stays with them if they are not willing to go with the emergency assistance, to make sure that they don't slip back into that overdose or that they don't use again. However, you do need to know that there is a good chance that they will decline help and that they are not willing to accept that. But you need to just do everything that you feel comfortable doing to keep them safe. Next slide. What is this slide?
Yeah, we added this in. So this is a quick, like, what are the steps? So,
Sweet.
yeah, people can just type them in the chat.
Okay.
Yeah, does
Okay, I
anyone
didn't even
remember
see this one. This is cool.
Yeah, this is new. So yeah, can anyone say what step number 1 is? Feel free to come off mute or drop it in the chat.
Check if they're responsive.
Yep. Great. Try to wake them up. I see in the chat. Perfect. Okay. What do you do next? What's step number 2?
Come on, this is a safe place. If you
Yeah.
can pick up on it, it's totally fine.
Yep. Yep. So, yep, check breathing, sternum rub. All of those are kind of a part of number 1. Trying to wake them up, checking for the breathing and the symptoms. Once you've established, yeah, I see it.
Ooh, there
Call
you go.
911. Yep. Perfect. Call 911. So once you've called 911, what's the next thing that you're going to do?
Lay them on their back.
Yep. That's an important one that is a part of the one that we have here. So yep, administer 1 dose of naloxone, and part of that is laying them flat on their back. Yep. Okay. What do you do after that?
Do you wait 20 minutes?
Important. 2 minutes. Wait.
Oh,
Yep.
sorry, 2 minutes. Sorry, two.
Yep. Yep. You wait 2 minutes.
Oh,
Yep. And
there you
during
go.
that time, you're ideally providing rescue breathing if it is safe to do that. And if you have a face shield and feel comfortable doing that, you recommend it. Yep. All right. What do you do after the 2 minutes of rescue breathing? If the person is still not breathing on their own.
Wait 2 minutes and then give another.
Yep. You're going to give another dose, a second dose. Perfect. Okay. And then same thing, you're repeating that 2 minutes of waiting and rescue breathing during that time. What would you do after that if the person has started breathing on their own? See recovery position in the chat. Put them in a safe position on their side. Yep. And then stay with them. Try to encourage them to get medical care. Tell them what happened. I'm seeing that in the chat. Perfect. These are all things we want to do. Okay.
And I do want to clarify, I know we just gave you so much information. If you remember to call 911 to give them naloxone and to do the rescue breaths for them, that was amazing. You did absolutely everything. And every single package of Narcan, all the different types of naloxone, even the kits that we hand out, they all have visual pictures on them. So when you panic in the moment, it's going to help walk you through it.
Yep. Thank you, Liz. And I also, I added a link to a 4-minute video that, if you want to see it several times, it's great to just watch it and see that repetition of how you would respond. I also included a few other resources like the Never Use Alone hotline. And if you want to access naloxone, some different ways that you can do that. And then, as we mentioned at the beginning, if you need support, if you have questions, please do not hesitate to reach out. Elizabeth is providing her information there. Thank you. And we also have our email for general questions. So we're really short on time, but I do want to make sure that we open it up if anyone does have questions. I'm seeing a couple in the chat. The first one, does